absolutely fine. So I'm recording now, just to let you know, and we'll get into the presentation. So thanks very much for joining us. Just to mention a few things at in the sort of the background to this particular training, and just a little bit about who we are before we get into the kind of the detail. This presentation and training has been sort of put together with the help and the sponsorship of Medtronic and the Wheel help desk, and I think your kind of contact with this is either through the Wheel or possibly directly with ourselves. I think Grace in our office has probably been facilitating as well. So just to thank their assistance in putting this together. I'm obviously here with an organisation by the name of Adair Human Resource Management, and we're, as the name would suggest, kind of leading experts in HR. As I'm trying to get the slides to click on, which inexplicably won't for some reason. Yeah, we're leading kind of experts in HR functions. So I'm here as a health and safety consultant with Adair. Some of the roles that we kind of execute, if you like, is the ordinary day-to-day stuff in relation to employment law. So anybody that comes into the workplace obviously has to have you know, a contract drawn up, and it all has to be compliant with existing employment law, so that everybody has a fair, or gets fair treatment in terms of the expectations, the terms of the contract, and remuneration as well. So we would assist in that regard, and obviously HR management on an ongoing basis. We also assist in the sort of the bad times as well, I suppose, when things don't necessarily go to plan, when people are maybe disputing elements of their contract, or where they're looking for a change in terms and conditions or whatever. So conflict resolution and industrial relations resolution is part of what we do as well. An offshoot of that, I guess, is health and safety. So in expecting to come into work and be treated fairly in terms of the hours you're expected to work, the money you get, and the facilities and the other bits that go with it, you're entitled to come into work and to expect to be managed safely in a safe way, and that's my role here from a health and safety perspective. So some of the organisations we work with will be sort of aid agencies, charitable organisations, and equivalents, I suppose, which may be similar to what you guys do. I'm mindful of the fact that I think maybe a lot of the guys in this particular group, you're obviously known to each other. You're probably from the one organisation. If somebody maybe just wants to come in there, Deborah, would you mind, what's the name of the organisation that you guys are all working with at the moment?
It's the Irish Kidney Association.
Irish Kidney Association, lovely. Sorry for not being aware of that. It's just, I'd say, everything is facilitated through Wheel. So yeah, I mean, it's not a charitable organisation per se, but an aid organisation, and obviously that it has a role to play, and an information organisation. So no different, I suppose, from things there like the Matter Foundation or Acquired Brain Injury Ireland. So you may have a fixed work base, or I'm not sure if your role is mobile and that your workplace is out and about at times. So we'll talk about all these things as we go along. And it's a generic presentation to a degree in that it talks about the requirements under the Return to Work Safety Protocol. But to give you an idea, and you can kind of visualize, you're probably already visualizing maybe some of the challenges that may lie ahead specifically for your own workplace. And to give you an idea, the type of groups I've delivered this training to over the past couple of weeks and the challenges that they would be presented with, I heard you mentioning pubs and restaurants already, and I've kind of delivered presentations to that profession. And you can imagine obviously the headache that COVID-19 has caused for them in terms of having to redesign their workplace, having to redesign their work practices to ensure they're doing it safely. Hairdressers is another one I've done, and again, similar organisation. I mean, how in the name of God are we ever going to get our hair cut while following these kind of these procedures? Radio stations, museums, kind of standard office type work as well, but in an old Georgian building. So again, if they're trying to adapt the workplace, it's very difficult to redesign a Georgian building to maybe suit some of the things that are being, spoken about here. So if you have any specific queries in relation to your own organisation, it may be that I can kind of give you an answer on it, or following today's training, you may have issues that you might need to bring forward to either management in your own organisation, or maybe that is you, maybe you're a supervisor and you need to kind of take it on board yourself. There's also a role that we talk about in the training here, a lead worker representative, and they may be the person that you might go to with any queries you have. But as I say, we should have hopefully 5 minutes at the end where I can address these things. So why are we doing this training? Well, we obviously closed everything down. You guys, I suspect, may have been working from home. So while it wasn't normal service, you weren't sort of furloughed, or you weren't, made redundant or whatever, potentially, unlike a lot of other people who basically their job was discontinued. So regardless of kind of what happened in the past, we're now attempting to reopen. And there's been 4 phases, originally 5 phases in reopening, now down to 4. And most places are kind of in a position to reopen as of last Monday. June or July 20th is the next day that we can reopen other businesses. But the whole point of the dates in relation to the phases of reopening, it's only if you're in a position to reopen should you reopen. No different to if you were starting a new business and you'd plan to open on, the 1st of January. But if the workplace isn't ready, if you don't have the right equipment, if you don't have the correct number of staff, you're not going to open. So simply because workplaces are allowed open doesn't mean that they can, because they can only open safely. And that's what this return to work safely protocol discussed and outlined. It's a national protocol for employers and workers. And really all it does is it echoes existing health and safety principles. The employer has always had a responsibility to provide a safe place of work and all of the things that go with it. And the worker or the employee has always been obliged to follow safety protocols in the workplace. This is no different. All it does is it talks about COVID-19 specific elements. So if you're familiar with health and safety, all you really need to do is have a reasonable grasp of COVID-19, and this is very straightforward stuff. Now, obviously, certain circumstances will be challenging, such as hairdressers and bars, restaurants, and they've had to look at sort of some creative ways in which they're going to do their business. And some places have had a look at it and just decided, no, I'm not going to reopen because it's just not practical, and that's unfortunate as well. So it's a living document. It's subject to change, so it's by no means the finished article. And health and safety is by no means ever put to bed. It's always potentially changing, in that there may be new technologies, there may be new innovations, there may be new work practices that we need to take into consideration. So health and safety is always a living document, and this is no different. Because of the kind of the size and scale of this particular crisis, everyone has had an input into it. So it's not only a health concern, a public health matter, it's an economic issue. So hence the Department of Business and Enterprise have been involved. It's a workplace health and safety issue. So obviously Health and Safety Authority have been involved as well. And they will continue to contribute in order that everything is done in as balanced a way as possible. And that whole sort of contribution and collaborative ethos, if you like, is echoed throughout the document in terms of you guys need to have your say, need to do your bit, contribute, and cooperate, but also, as I say, contribute as well in terms of if you have an idea, if you have a suggestion, and anything reasonable should always be considered. That's always been the case in health and safety. This is nothing new. It's just probably made health and safety more of a day-to-day topic for most people. So this is what we're going to cover. I'm mindful that an awful lot of this stuff is covered widely in the media, so you may know a lot of this stuff already. Maybe it's a case we've got a little bit kind of bored with it because things have kind of gone well for the last couple of weeks and we may get complacent. So it's important, obviously, to have these reminders regularly so we don't fall back into tougher times. And the point 2 and point 3 there is really health and safety in a nutshell, in that if you know how something causes you harm, so how does the infection spread, we can then prevent the spread of infection. In the same way that if you know the dangers in relation to crossing the road, we can then take steps to prevent those dangers. And very simply, the danger crossing the road is that you're going to get knocked down by a car. So how do we prevent that? Well, we look left and right and we only cross when it's safe to do so. And we wouldn't have known that had we not been, told that as kids. If kids aren't sort of told how to cross a road carefully, they'd probably step out in front of the first car and they wouldn't realize the danger. So that's the same principles that are involved here. And if we understand a little bit about COVID-19, then we can sort of take evasive measures. And it's not rocket science. It's very simple steps. And it's the stuff that's been widely covered. Now, again, you may need to tailor certain things for your own workplace, and there may be some changes which may require more cooperation and a little bit of disruption. But everybody, as I say, is asked to kind of put their their shoulder to the wheel here. And that's true nationally. So even people who have no workplace to go to, either they're out of work or they're retired or they're students, we're all been asked 24/7 to do these things, you know, and you've seen it already. You've gone to the supermarket or the shop or maybe a cafe for a takeaway coffee, and you've seen the measures they've put in place, some good, some bad. So we're not unfamiliar with this. We just need to understand how it's going to work within our own workplace. So I'll talk about the employer and worker responsibility. So obviously what your organization needs to be doing, and then what you need to be doing. The role of the lead worker, so that's an appointed role, which I'll talk about as well. Other familiar things just in relation to our own personal, keeping our own house in order, good hand hygiene, when we should do it, respiratory hygiene, cough and sneezing. So personal habits really. Again, some people are doing this all the time, so it's no big deal for them. You know, they wash their hands thoroughly, and not in a, you know, obsessive kind of way. It's just they're clean people and they take time, the extra little bit of time to just be a little bit more thorough. For other people, they may not wash their hands at all, or their personal etiquette in relation to coughing and sneezing is questionable. So they're the people we need to sort of bring along, and it can be sensitive areas when you're talking about personal behavior. Signs and symptoms of COVID-19, just to remind people what to look out for. And then what you might do if somebody comes forward, be it a customer, be it a client, be it a visitor, or be it a worker, and they suspect, you know, they may have, not that they suspect they have COVID-19, but just they're unwell. And we need to then follow a protocol on it. Again, it has to be tailored for your own workplace as you see fit. So there's loads of corona. If you were to say coronavirus to a scientist or a medical professional, they'd say which one, okay? So we know that the current kind of coronavirus to be the one that we're dealing with. COVID-19 is probably the most accurate name for it. Coronavirus disease, COVID, 2019. And there's hundreds of them in the animal population, and occasionally they transfer over into the human population, and they've done so on previous occasions. This is the 7th occasion, not the 19th occasion, as Simon Harris famously said. So the previous 6 coronaviruses, 4 of them were mild. And the odds are you've had a coronavirus in the past, because all it is a cold. That's what it's caused. There's no cure for it. There's no vaccine for it. I suspect they could get one, being a little bit cynical, but because colds don't kill people, you know, debilitating as they can be from time to time, I suspect there's more money in the pharmaceutical industry from your cold remedies rather than your cold cures. But anyway, that's a different debate. 2 of them were nasty in the past. So 4 were mild, 2 had the potential, and only the potential, they didn't always do this, had the potential to cause severe acute respiratory syndrome, SARS. The other one that was in and around the same time from about 15, 20 years ago, I think it was MERS, Middle Eastern Respiratory Syndrome. And they just evolved and mutated into a nastier form. Now, not everybody kind of got a bad dose, but this was different than your common cold. And they were working on a vaccine for both of those at the time. But they were very successfully suppressed. I don't know how they managed those outbreaks, because there was an initial panic about this years ago. And if you look at some of the commentators who are still commentating today, their view, a famous, I think he's an immunologist or a virologist in the UK who very famously resigned because of his social distancing habits, predicted that SARS was going to be a global pandemic, and it never materialized. I'm not sure how they managed it so well in comparison to COVID-19, because I don't think there's any doubt that globally it wasn't managed very well. Sporadically, some countries did do a very good job. And I suppose the debate will be ongoing as to whether we were one of those countries. But anyway, there's no vaccine as a consequence to either of those, and we've no work done. We're starting from scratch again on COVID. There's treatments are improving. And again, if you're following this in any sort of way, you'll see that there are, and it's not hydroxychloroquine or whatever it is that Donald Trump is advocating. You know, it's not, you know, there are more established and scientifically proven treatments being developed all the time. And certainly not drinking or injecting bleach, as he also advocated as well. So how do we control the spread of the virus? We break the chain of infection, okay, which we should do for all viruses, okay? If we know how COVID-19 spreads, we can then do things to stop it spreading. Now, it's not perfect, and there's always going to be a slight risk with anything. You know, we can never eliminate all risk. You know, if you were truly worried about getting knocked down when crossing the road, you simply would never cross the road, because there's always going to be some sort of a risk, even at a set of traffic lights where someone might break the lights, or there may be an emergency vehicle coming that you don't see. You know, it's very, very, very small. So we accept a certain amount of risk in life, but what we do is we do whatever is reasonable and what's practical to try and reduce the spread of infection, specifically for COVID-19. So how does it affect you? It gets into your mucous membranes. So what are they? That's your nose, your mouth. The moist area inside those is kind of a good place for bacteria and for viruses to live and grow and spread then as a consequence. And your eyes as well, which is kind of unusual because we can kind of think of the nose and the mouth as part of our kind of our respiratory system, our breathing system, but the eyes is the odd one. And the greatest risk is when there's airborne particles. So there's stuff floating around in the air that hasn't landed on the surface or hasn't reached the ground yet, and we inhale it. Now, there's loads of things at play there as to whether or not you're potentially going to get infected, how much of the virus is there. So naturally, if somebody is coughing or sneezing, there is going to be more virus. If you're closer to that person, so if you're within 2 meters, there's a greater risk. If your own immune system is a little bit weakened, maybe you're stressed, maybe you're tired, maybe you've had a run of bad illnesses or bad sicknesses, or you're older, and obviously there's a cohort of people who are kind of at more risk for this, then you have a greater risk of potentially getting infected. But it's all ifs and buts. There's no guarantee that if somebody coughs in your face that you're simply going to become infected. There's a little bit of a lottery in this as well, and we have to say we accept some element of risk in our daily lives, but we should know the areas where we're at greater risk. That's the main risk, is airborne contaminated droplets. There's a secondary risk that if you touch a surface that's contaminated and you then touch your face, that you can transfer the virus to your eyes, your nose, and your mouth. And that's why the advice is hand hygiene, don't touch your face. Okay. Now, obviously, at certain times, sorry, go back there. At certain times, we have to touch our face. We might eat a sandwich. We might have an itch. We just simply can't avoid scratching. Maybe you bite your nails, and possibly now's the time to stop. But as long as your hands are clean, there's no problem. It's when we've maybe been touching surfaces, when we've been on public transport, when we've been, operating handles or operating machinery, and we haven't either followed hand hygiene through washing or using alcohol gel, that we may have picked up a virus, and it can be any virus. So we've probably all had a dodgy tummy, a sick tummy at some point in our lives, and the chances are is because you introduced a virus into your system via your hands, an invisible virus. Now, we're not going to eliminate all of these, but if we're just probably a little bit more prudent about our personal habits, hygiene habits, we will probably reduce the amount of sick tummies, and we will probably reduce the amount of flus in circulation every year. Lockdown will be very effective in that regard. There's absolutely no two ways about it, but it's not a practical way to do things long term because loads of other things happen as a consequence. So if we're a little bit more diligent about washing our hands, minding our personal hygiene, about as an organization cleaning surfaces, about being mindful and honest, I suppose, if we're symptomatic, that we don't leave the house. And that's a new thing probably for a lot of people, that whereas we might have struggled into work feeling a bit sick, the national guideline is now no, you don't go out, you don't go to the shops. If you can work from home and you're well enough to work from home, fine. But there's a kind of a call to arms now where we're being told, this is a national emergency, an international emergency. So clean hands, good, clean environment, good respiratory hygiene. Very simple. That's all it is. Now, in certain circumstances, we need to get in close contact with somebody because our role requires it. Healthcare, hairdressers. In those situations, then we look at barrier devices, personal protective equipment, and face shields. And that's the very simple algorithm, as I say, the protocol and the considerations that workplaces are following. Try and eliminate the risk within the workplace as well. So if you've any shared objects that don't really need to be shared, they're suggesting that they be removed, particularly any item you might likely to put to your mouth, such as bottles or cups. Now, again, in pubs and restaurants, they're shared all the time. But you would hope that they have a very stringent cleaning regime in place. No different to when you went to a pub or a restaurant 6 months ago. You're relying on the fact that they've prepared the food safely, that the glasses and the cutlery is clean. We sort of trust them because they say COVID-19 is not the first virus to ever emerge. It just happens to be one they didn't know a lot about. And that's why the reaction was the way it was, is because we didn't know anything about it and we're not really sure how to deal with it. So shared items where possible should be removed. Some elements of equipment are going to be shared. Maybe there's a hot desk, people who share desks. Again, pubs and restaurants, they share cash registers. They may have electronic ordering devices, little electronic devices they carry around to take your order. And that's fine if it's cleaned down after each use, so that the next person who picks it up is picking it up with clean hands and they're picking up a clean device. This is not a huge imposition. This is just changing a little bit of organization in the workplace. So again, you may have ideas in your own head about how you might need to apply that to your own workplace. Good respiratory hygiene, and where possible, maintain a 2-meter distance. So the employer responsibilities, and again, this simply echoes health and safety responsibilities. Prepare a COVID-19 policy document. So there should always be a safety document in every organization, and COVID-19 arguably should be just a new chapter. Now, a lot of organizations don't have any safety documents, and the reason it needs to be documented is that if anybody has a query about what we should and shouldn't be doing, they can just refer to the document and that will clarify it for all. Because there's always a bit of debate, particularly in industries where, you know, health and safety is quite crucial. Let's say a building site, and, you know, one person may say you're supposed to wear goggles when you're using that piece of equipment. And then somebody else might say, well, no, I wasn't told to wear goggles. How are we going to solve this? We'll go to the policy document, the safety policy document. So for some organizations, this is a new thing. We're having to sit down and start from scratch. And we need to develop a response plan. And that should be communicated, it should be developed and done with the consultation of the workforce, and then communicated accordingly. So consultation has always been a feature of health and safety, either formally through a safety rep or informally just through the employees. Some organizations are probably good at doing it and it just happens organically, where we all feel involved in the kind of the process. Other organizations maybe not so. So again, your own organization, you'll have a view on that. And when we've agreed on the prevention and control measures that are to be implemented, we implement them to minimize the risk. Again, no different to any control measures that we have in the workplace currently. And then the employer needs to engage with an appointed worker representative. So that's a lead worker. Again, the legislation has always had a facility for a safety representative, if you want one. You don't have to have one. Section 26 says you may have one if you want, and it can't be refused. But a lot of organizations don't bother. They're just happy to deal with the body of workers, and it works well. Things move smoothly. People suggest stuff. We take them on board or not. And there's a good kind of atmosphere in that regard. Other organizations maybe not so, and that's when they might go, look, we're going to appoint a safety rep here to keep an eye on you guys. There's no gray area with the lead worker representative. It needs to be appointed, and I'll talk about that role in a second. You may need more than one, depending on the scope and size of your workplace. The employer must keep up to date with new measures introduced by government, but that's nothing new. If there was a change in any legislative requirements relevant to the workplace, it's up to the employer to know what it is. In the same way that it's up to you to know if there's a change in the speed limit on a road. If there was a change in pub licensing hours, it's up to the pub to know I need to close my doors at a different time now. So nothing new there. It'll be difficult not to keep up to date given the attention this stuff is receiving. They then need to pass on any relevant information to their workers. So if there is a change which affects the employees, we need to include it in our documentation and, you know, tell our workers about it, either through an email, a circular, or maybe even just a team talk, just to say, look, this is what's happening next. And that's, again, something that's always been a feature of health and safety. Display information relevant to COVID-19. Again, health and safety information is not new. So you won't see much of it in certain workplaces. You may see just a no smoking sign. But in other areas, you'll see a lot of it, such as, you know, you have to wear gloves and goggles or head protection, no entry, trained personnel only, all of that kind of stuff. This is just a bit more in your face. And again, we'll have seen plenty of this in any shop or supermarket that you will have visited recently. So relevant information, reminding people of signs and symptoms, correct hand washing technique signs in the bathrooms, maybe hand gel information adjacent to a hand gel pump, reminding people of their own personal hygiene and respiratory etiquette. So just signage to say, cover your nose and your mouth if you're sneezing, use a tissue, dispose of it. If we're physically distancing, again, signs to remind people. You know, you see them in shops where you're obliged to stand on a dot when you're queuing. They're not great things to have to do. Personally, I don't like it, but I understand the reason for them. So I'm hoping that we won't have to live with them for much longer. But certainly hand hygiene and respiratory hygiene, if we take nothing else from this going forward, and if we keep that, if we can get rid of everything else, but we keep that, I think that'll be a really good thing to do. And obviously they need to adapt the workplace to facilitate physical distancing. So if we have a staff room or a break room at 11 o'clock, 12 of us cram in and we all have a chat. And in the past, that was fine. Now we might need to stagger breaks. And in order to kind of discourage people from congregating, we might need to take out, say there's 12 chairs, but we can only accommodate 6 people in that room. We take out 6 of the chairs and put up a sign to say, look, maximum number of people here. But again, that should always happen in consultation with the staff, that if you need to say, well, look, I'm still entitled to my break, or I'm still entitled to this, that you're still facilitated in that regard. If it means decommissioning workstations so that there's more of a gap between you and your co-worker, you know, so be it. So some places have a lot of work to do. Again, pubs, restaurants, there's a couple of pubs are installing screens and barriers. So there's a group of people are doing very well out of this. Whoever invented Perspex is probably making a fortune. And obviously people who are redesigning workplaces are able to operate very, very profitably in this. And unfortunately, there's a lot of other workplaces are no longer in business. More responsibilities of the employer. So where possible, keep a log of who's working with who. So the key thing is the term close contact. If you're within 2 meters of somebody for more than 15 minutes and it transpires that they are infected, you are now a close contact. And you are then obliged to self-isolate, even if you don't have symptoms. If you develop symptoms, then you initiate a test. So the rule on it is that if you have to work in those kind of close quarters, you need to keep a note of who you're working with. And you should consider alternative protective measures in that regard, such as PPE or barrier devices. And obviously healthcare professionals is a perfect example of that. Rostering will help in terms of who's working with who. If you're outside of the 2 meters, then you're only deemed to be what they call a casual contact. And as long as you stay well, there's no need for you to do anything else other than just be mindful in terms of, I wonder if that cough that I'm now developing is something to be concerned about. The chances of you kind of becoming infected are kind of very, very slim. And if it is, it's probably because of another reason that you haven't thought about. It's a bit of a mystery as to kind of how people get infected, because anecdotally people are saying, I don't know how I got this. I was safe. I was doing A, B, C, and D. And then there's other people who are taking huge chances. And they're probably thinking, I don't know how I didn't get it. So there's an element of luck about it, as there is with any illness or injury. And a lot can obviously do, I suppose, in relation to your own personal health. But if we take these simple measures, you know, it'll keep the vast majority of people very safe. And in any event, there's very little, if any, infection in the community as things stand. So unless there's something lurking that they haven't discovered, we're in a very good situation at the moment. But we just need to keep it that way. Workers need to attend induction training, which is what I'm doing now, obviously. And they need to develop a procedure to follow should anybody, you know, exhibit signs of COVID-19. But again, that's no different to a procedure we should have if somebody gets sick. So there should always be a first aid policy. Again, it may be casually addressed up till now, or if at all, you know, somebody gets sick in the workplace, or somebody gets injured, they fall down the stairs, and everybody stares blankly at each other because they don't know what to do. We can't do that now. We have to be a little bit more prepared and a little bit more on the ball. The instructions in terms of the protocol to follow should be issued to the staff, so I know what to do if I feel ill, or if somebody comes to me and says, I feel unwell, I know immediately what I need to do. It may involve alerting the lead worker, the role I'll talk about in greater detail now in a second, or it may involve alerting the first aid person if you have one on the premises. Just know what procedure you need to follow. In the same way you should know what to do if the fire alarm goes off. You know, most organizations, it's straightforward enough, I just get out. But you should know where you're going to assemble. You know, so we should always know what we need to do in the event of an emergency. Employers need to intensify cleaning as well. So we just need to pay a little bit more attention to our cleaning regime. Have it documented so we can back it up with evidence that we did clean this area, you know, on a regular basis, or we are paying more attention to things like door handles, to push panels, to frequently used pieces of machinery, even if it's the kettle in the staff room, that we are now getting people to wipe it down after every use, or maybe every couple of hours, whatever may be appropriate. So everybody needs to kind of contribute to this, because we can't have just a full-time cleaner going around the organization cleaning up after you. But if we have the signage and we have the policy in place, the responsibility then rests with all of us to do our bit. So your responsibility then, which is kind of bringing it into more focus, is before returning to work, you need to complete a pre-return to work form specific to COVID-19. And it just asks you about you're just declaring your fitness in relation to COVID-19 as and of that time. I've no symptoms. I haven't had any. There's nobody sick at home. I haven't been told to isolate or cocoon, and there's no other issues which are not included in the form that are relevant. Okay. Now, if 3 days later you feel sick, that form isn't the kind of is kind of no good, because the form is only relevant as and of that day. If 3 days later you feel sick, you stay at home, you contact your GP. So self-isolate, contact your GP. If it happens in work, we'll follow a slightly different procedure. So it doesn't absolve you from the need, this form doesn't absolve you from the need to react should you feel ill at another time. Obviously, your GP will then decide what way we're going to go with regard to testing and all the rest, but stay out of work until otherwise advised by your GP and until all symptoms have cleared. Obviously, if you're initiating a test, you will have regular contact then with your GP, because you're now sort of in the health system, as it were. You're obliged to participate in any induction training, which is what you're doing today. If your workplace is bringing in temperature testing and it's been agreed, comply with it. I think the intention at the start was that every workplace will be taking temperatures, but I don't think that's practical. It will potentially eliminate some people who have temperatures, but you have to remember the temperature is not exclusively a sign of COVID-19. It can be a sign of something else, and it doesn't have to be something sinister either. You know, sometimes people are slightly hot, maybe after exercising, or maybe if they're a bit dehydrated and their body just hasn't cooled down. So if it's there and it's agreed upon, you know, well and good. What I would recommend is maybe workplaces can add a thermometer to their first aid kit. It'll just help with your diagnostics if somebody is sick. If you've got someone who's trained in first aid, they'll be familiar enough with doing patient assessment. And if somebody says, look, I don't feel well, and you say, right, we're going to the isolation room, that's where we go with people. How are you feeling? You know, you pop a mask on them. You may hand them the thermometer and say, look, just point that at your forehead and tell me what your temperature is. Infrared thermometers, non-invasive, and it'll just help you make a decision as to kind of how you're going to treat this patient. It's not conclusive in any way, but it's just a diagnostic tool. If we're putting in workplace physical distancing measures, you're obliged to comply in the same way that if you're supposed to be in work at 9 o'clock in the morning, that's what you're supposed to do. Okay, so if you don't like it, tough. If it's in the greater good and it's all been agreed upon, you just have to comply. I don't like standing on a dot in the supermarket waiting for the like, I would always like to think I observed people's personal space, but having to stand on a dot like a you know, a lamb to the slaughter in many ways irritates me a little bit, but I do it. You know, I do it begrudgingly. Exercise good hand hygiene. So again, we're not going to be chasing people around saying you didn't wash your hands properly, taking out a stopwatch to see that they do it for a prescribed length of time. But we need to encourage it through signage, maybe little team talks, maybe emails or circulars on a regular basis, just to keep people on board. Same with respiratory hygiene, just to remind people how important it is. You need to keep up to date with the latest advice. So if you've switched off all of your electronic devices, you don't look at the news anymore, that's not an excuse. Ignorance is no excuse. So if, for argument's sake, we went back into lockdown and you're rambling around, going for your walk on the beach, you know, you can't turn around and say, I didn't know about it. It's very widely covered at this stage, and any changes in the future will be as well. You need to cooperate with any of the control measures, as you need to do with any control measures in the workplace, and report any issues or concerns you may have. So this lead worker representative I've mentioned a couple of times, this must be appointed, and you may need more than one. People may be happy to volunteer for the role, or they may need to be coaxed into it, you know, if there's nobody stepping forward. But the simple fact of the matter is somebody has to do it. They need to be clearly identifiable. So some workplaces are wearing IDs, maybe a tag or a bib, a high-vis jacket on building sites is something I see. It just means that if a member of the public or a visitor, you know, needs to see or needs to go to who the lead worker is, that they know exactly who to go to. You guys should know who it is by name. You know, you should know who your first aid qualified person is if you have one. You should know who your fire wardens are. You know, these people should be known to you. We shouldn't be, as I say, staring blankly at each other in the middle of a potential issue, trying to figure out who's who. You should know these things, and the organisation should circulate you with the information. They need separate training. So there's a separate course that we're delivering for the lead worker representative. They work collaboratively with the employer. So again, collaboration has always been a feature of health and safety. This just formalizes it a little bit more. So they're the kind of go-to person who'll come forward with suggestions, who'll take information back to the staff members if that's appropriate, just so that, as I say, we can all contribute to this process. And they're also obliged to monitor adherence to the measures. So it may require reallocating some roles. If you've got a busy workplace with a lot of visitors, and you've been asked to, let's say you've changed the flow of people coming in and out of a supermarket where we've one way in and one way out, and there's somebody on the door there to monitor adherence to that. They can't be expected to do other duties within that sort of remit. So again, there may need to be some renegotiation of tasks and activities to take this into account. So hand hygiene, I'm not going to dwell on that slide because we have a video that illustrates that perfectly well in relation to hand washing. It's a combination of time and technique. So it's not just washing your hands for about 20 or 30 seconds. It's about doing it thoroughly, as you'll see in the video. There's a second form of hand hygiene, which is done by rubbing alcohol gel or an alcohol-based gel into your hands. And any of the companies that supply this stuff will give you the proper 60% minimum alcohol gel. If you're making your own home-based preparation, there's a little bit more to it. And the technique in using the gel is the same technique as you use in washing your hands. The only difference is you don't use water, you don't dry your hands, and you substitute the gel for soap. That's all. So I'll let you see the video and you'll see what's involved.
Wet hands with water and apply enough soap to cover all surfaces of the hands. Let the water run smoothly to avoid touching the tap later on. Rub hands palm to palm to obtain a good quantity of foam. Then rub right palm over the back of left hand with interlaced fingers and vice versa. Rub again palm to palm with fingers interlaced. Rub the back of your fingers to opposing palms with fingers interlocked, repeating this action for each hand. Rub rotationally left thumb clasped in right palm and vice versa. To clean the tips of the fingers, rub rotationally backwards and forwards with clasped fingers of right hand in left palm and vice versa. Rinse hands thoroughly with running water. Dry hands thoroughly with a single-use towel. If the tap is not elbow operated, use this towel to turn off the tap without touching it directly. Your hands are now clean and safe.
So you can see that video is from 2015, so we haven't just suddenly changed our hand washing techniques because of COVID-19. And I'll hold my own hand up, excuse the pun, to kind of admit that I myself was probably a little bit lax in my hand washing. You know, so we all probably need to up our game in that regard. So regular washing of hands at the appropriate time, which comes up in the list now, and obviously is a combination of time and technique. The girl in the video was probably sort of overemphasizing the technique a wee bit there, so you can probably hone or perfect that little technique in time. But certainly, particularly for the guys in the room, I suppose, without being judgmental, the days of kind of washing one hand under a tap for a split second as you leave the loo and then wiping the hands in the back of your trousers is gone. You know, you have to remember, and you know, that'd be typically, I suppose, you'd see that in the pub bathrooms after using the bathroom. Your hands are going to pick up contaminants all throughout the day. And that's why they discourage you from touching your face, because you just don't know what's there. And going back to what I said earlier, it could be the tummy bug, it could be the flu, stuff that we get all the time and we probably don't really think that deeply about. It's not just going to the loo that's potentially going to contaminate your hands. So if you just kind of give it a quick cursory wash, there's loads of other stuff all over your hands from the previous 3 hours activities that could be there. And 99.9% of it doesn't cause you any difficulty. But if we maybe spend an extra 10 seconds in every visit to the bathroom, it's not asking a whole lot really. So when should we do this hand hygiene? Either washing our hands or gelling our hands. So if your hands are dirty, the second last one there, if they're soiled, visibly soiled, you should be washing your hands with soap and water. But for any other activity, such as the ones listed there, if your hands are generally clean, hand gel will be fine. So after coughing and sneezing, before and after eating or preparing food, if you've been in contact with somebody, these may sound very obvious, but again, just to reiterate, in contact with somebody who's displaying COVID-19 symptoms, any symptoms for that matter. You know, if you have a sick kid at home and you're helping them to bed, or you're cleaning up after, whatever might have happened, or they sneeze or cough, wash your hands. It doesn't have to be COVID-19 for us to suddenly think about hand hygiene. Before and after using public transport. So again, you may be a long way away from a bathroom or a sink, but you may have hand gel in your bag or in your personal belongings in your pocket, a little hand gel, rub it on. Now, remember, provided you don't touch your face, there's no real danger there. It's not going to jump off your hands, but you'd be surprised at probably the amount of times we inadvertently touch our faces and not know it. And it just maybe provides a bit of reassurance. Don't overdo it, I suppose, because it won't be long before the skin is kind of hanging off your hands if you're doing this on an over regular basis, but at the appropriate times in a prudent way. Before and after being in a crowd, again, there's airborne particles that may land on your hands. If your habit was, going around barefoot and then putting your foot to your face, if you could still do that, we'd be advocating the same thing for washing your feet. So the hands are the area, obviously, that are kind of most concerned. It's not that they're unique in terms of carrying germs. When you arrive into work, when you arrive back into the house, when you arrive at another work site, find a wee bit of hand gel, squeeze it on. If you go to the bathroom to wash your hands to freshen up, better again. If you have to put your hands to your face for whatever reason, if you're a smoker or you're eating food or taking medication, do it with clean hands, and then obviously after using the bathroom. Respiratory hygiene, again, is just something we should probably always have been doing. Source control measures, so cover your nose and your mouth. It's just good common decency. If you can, use a tissue. If not, you may need to use your arm. Wash your hands afterwards. If you need to turn your body away, maybe there's 3 or 4 people in a room and you can sort of turn to face the wall as you cough or sneeze. Again, it's just a gesture to show that you're considering others. If you're adjacent to a door that leads to fresh air and you think you're going to cough or sneeze, step outside. I'm not saying you sprint for the nearest exit if you feel this coming on, or evacuate the building. Just if you can prudently take some steps. Obviously, people in customer-facing roles need to be mindful of this. If you're in a bar and restaurant, for example, or a hairdressers, again, the 2 famous examples I've been using. The last thing you want, even if they're wearing a mask, is for that person to cough directly at you. So you would hope that they would do it prudently, and we should do likewise. So to talk about the signs and symptoms, again, things that are very familiar to us, but again, no harm to have a reminder. The simplest way to broadly remember the signs and symptoms is that they're flu-like. And also, kind of conveniently, COVID-19 spreads in a similar way to flu as well. But that's where the comparison ends. So anyone who compares COVID-19 in a sort of physiological way to flu is wrong, because it behaves very differently when it actually infects you. But if it helps you remember the signs and symptoms, and it helps you identify the dangerous times, airborne droplets, contaminated surfaces onto our hands and then into our face. So fever, cough, shortness of breath or breathing difficulties, but there's more. Sore throat, achy muscles, kind of weakness and tiredness and fatigue that is kind of beyond normal, where you're just really, really lacking in energy or flat. And one curious one where a sudden distortion or loss of sense of taste or smell, believe it or not, is another one. So you'll get constant reminders of these. No harm to stay abreast of them. There should be signage in the organization to remind you as well, so that if you feel like this or you identify it in others, that you are not panicking, but that you're suspicious that it may be COVID-19 and we need to take suitable steps to avoid others becoming infected. Now, there is a cohort of people, again, the scientific community is not in full agreement on this, who are asymptomatic. There's nothing you can do about that. All you can do is practice good respiratory hygiene, good hand hygiene. Don't tolerate people who are coughing or sneezing openly on the basis that they say, I'm not infected. There's probably something lurking in those droplets that you wouldn't like to get. So we should all have good personal hygiene habits. And what do you do then if somebody does present with symptoms? And this is where the planning comes in for your own organization individually. If you're working off site or you're working in other organizations, you need to maybe think on your toes a little bit more, or kind of off the cuff. If it's an organization you visit on a regular basis, it may be prudent to ask them what their arrangements are. You're not obviously going to go into your local supermarket unless you're a complete nuisance and say, where's your isolation room? You'd be entitled to ask, and you'd be entitled to an answer on it. But if it's a workplace you visit regularly, and you're handing your safety over to another organization, it might be prudent to say, look, can you just give us a quick 2-minute run through on your arrangements if I feel ill, or someone in my company feels ill. So they need to isolate this worker. We need to bring them to a designated room. Ideally, the room should be well ventilated. That's not always going to be possible. It depends on the building you're in, depends on the age of the building. So people need to sit down and have a chat about what room we're going to allocate to this. Again, in legislation, there's been a requirement or a request for a first aid room all the time. So there should always be a room that if we can bring somebody to treat them with a bit of privacy and a bit of dignity, that there's one available to us. But very few organizations actually have them. There's no grey area on this. And if you got a visit from an inspector, I doubt your type of organization is likely to get one. But let's say bar, restaurant again, and the inspector pops in, he says, where's your isolation room? If they start looking blankly at each other and sort of shuffling nervously, they're going to be in trouble. And then next thing, the inspector's got to go, show me your documentation, show me your training plans. And if there's nothing there, they're in big trouble, So we need to get our house in order. Like being stopped by the guards, if you've loads of things wrong and you've no tax disc displayed, the tax disc could be the least of your worries. It could be the consignment of stuff in the boot that you're not supposed to have in the first place. So don't draw attention to the organization. Plus, make sure you have things in place to look after people if they need to be minded. Keep 2 meters distance from that person without creating a stigma or panic. Just say, look, I'm going to lead you to the isolation area. I'm going to escort you. Or if you're making your way there yourself, if you're feeling sick, just keep a distance in a prudent way. Make sure everyone else keeps 2 meters. So again, you're not going to, use a klaxon horn to get people out of the way. But if somebody needs to kind of walk ahead and say, look, there's somebody who's not well here, would you mind just leaving a bit of space? It's very easily done, doesn't have to be done in a panic way. Provide a face mask for the person who's unwell. So that mask should be available in the isolation room, if not elsewhere, that you could pick one up on the way. Give them the mask, pop one on yourself if you're staying there to just keep an eye. You shouldn't really leave this person on their own. By all means, put a bit of distance between you and them. But if you feel more comfortable popping your mask on, and there should be a good supply of masks in the workplace. So for the organization for whom the first aid kit was a cursory or kind of casual issue, now they need to keep an eye on it, because again, if the inspector calls and he says, have you got a mask? And there's no masks available, it's going to be a black mark on the form. Make an assessment of the individual. If they're well enough that they can make their own way home, they can drive home, perfect. Taxis are prepared to take people home. They will have barriers installed if you alert them to the fact that it's someone who's sick. Passenger will wear a mask. The driver will wear a mask if he or she chooses. Don't let them use public transport. That's discouraged, albeit it's, if the worker leaves your workplace, you cannot keep them isolated against their will. You cannot, retain somebody against their wishes. So if they leave the premises, you have to let them go. You would just encourage them to make their way home safely. If you can call a friend or a family member to come in and collect them, better again. Facilitate them staying in isolation if, for whatever reason, you're unable to remove them safely. Contact their GP if you can at that time, or encourage them to contact their GP when they go home. Get them to avoid touching surface unnecessarily. So you want to make your cleanup after the event more straightforward. Obviously, if they're fussing around, if they're stopping to do things on the way, discourage that. And so just, move them to the isolation room, give them a chair to sit down in, tell them, look, we're going to look after this for you, pop the mask on, just take it easy there and we'll sort this out. Remind them about the respiratory hygiene as well. Just if you feel a sneeze coming on, just make sure you have your mask on. Offer them maybe a box of tissues if there's one available. Cleaning wipes as well. Arrange transport home if that's appropriate, whatever is suitable. But if they're badly sick enough that they need to go to hospital, that doesn't change. Hospital is not a substitute, even though it is often used as this. It's not a substitute for a visit to your GP. If it's something your GP should look after, and just because it's Saturday afternoon and your GP is not open till Monday morning, you don't go to hospital as a secondary measure. You just have to wait if you're well enough to wait. But if you're sick enough that you need to go to hospital, that's fine as well. So if you have first aid qualified people in the organisation, bring them in to assess the patient. Obviously keep people to a minimum, but make sure you make a decision as to what's appropriate for that person. If you travel to hospital with mild symptoms of COVID-19, they will probably send you home, you know, so you're just wasting everybody's time. But obviously don't ignore other things that may be wrong with that person, which may require hospitalization. So, you know, don't rule anything in, don't rule anything out. Carry out an assessment of the incident. So how did we do? If it went very well, just compliment everybody who was involved, and we, you know, keep a record of it, and we move on to the next day. If it didn't go particularly well, we may need to sit down and talk about it, about whatever went wrong. Whether it was a bit of panic, we did this wrong, we went the wrong way to the isolation room, whatever it was, we'd no masks, then we need to fix it, okay? Same way as you would after a fire drill. If the fire drill didn't go particularly well, you need to sit down and have a wee chat about it. Arrange for the area to be cleaned, and obviously any area that they may have been working in. So again, if we know what they do, where they, you know, the area they've moved around in, we can clean it down appropriately. Remember, this stuff dies when it leaves the body. It takes up to 72 hours, depending on the surface upon which it lands. So don't be fearful that it's going to jump off and attack you and infect you. It's not. If it's in airborne particles, there is a danger there because you won't see it and you won't smell it. It's like carbon monoxide, for want of a better example. But obviously all those airborne droplets will eventually drop to ground, and we just clean the area that that person has been in. And then provide advice and assistance if the HSE contacts you. So the GP will take over the management of this, the person's own GP. If they don't have a GP, they contact the HSE and they will take over the management of it. If a test is ordered, the result will go back to the GP. If it's positive, then they may be in touch to say, we need to now start tracing people. And that's how the whole test and trace system is supposed to work. And obviously the less people we have to trace, the better. And that's why we've been asked to continue to be prudent about who we're mingling with, who our close contacts are. So before I summarize, if anyone has any questions you want to come in there, I'm happy to take them. I know it's a generic type of presentation, and maybe after today you may sort of be thinking, God, I wonder what we're going to do about this and what we're going to do about that. And there are conversations that you may have amongst yourselves, be it with a lead worker representative if one has been appointed, or just management or the organisation in general, to kind of ensure that you're one, you know what's expected of you when you go back to work, and also secondly, that you're happy with the arrangements that are in place. And if you have suggestions that you feel you kind of want to make, that there is a forum through which you can make suggestions, and provided they're not nonsensical or crazy, you know, everything should be considered. You know, everything in good faith should be considered, because the whole ethos of this is that we're all in it together. That's what's coming from the top, and that spreads beyond the workplace. So that's why if you're sick, you're told to stay at home, and that means not only not going into work, but not going to the supermarket, not calling to your pals. You know, it's a national kind of call to arms, as it were, and we're still in that, whether we like it or not. We're still in that sort of state, if you like, until otherwise told. Now, obviously, as things ease off and as things continue to go well, people are going to get a little bit more complacent. But if we're kind of sensible about it, I'm not suggesting people need to be complete hermits, but if we go about it sensibly, hopefully we won't have to live with it for too much longer, and then we can kind of get back to the proper normal, not the new normal, the old normal, in a reasonably short space of time. So thanks very, very much, guys. I appreciate your time taken to take this in. Hopefully things will go well. I think they will, certainly in the short term. The winter may hold a little sting in its tail, we'll see. But until then, we're in a very good situation. How we got there is open to debate, I suppose. But as things stand currently, we're doing very well, and let's keep it that way. So listen, thanks very much for your time. And I wish you well.
Thanks, Donald.
Thank you.
Thanks, bye-bye.
Thanks a million.